Well, now that Labor Day has marked the official end of summer, schools are starting back in. Many of them have been in for several weeks. Ohio State is back and has been back. It's really my pleasure today to introduce you to the president of Ohio State, Dr. Kristina Johnson, who I've been talking to quite often. I think she officially became the president of Ohio State on September 1, but I know that she has been very involved for the few weeks leading up to that. Dr. Johnson, thank you very much for joining us.
Thank you very much, Governor, and thank you for everything you and your team are doing to keep us safe and healthy.
Well, we just wanted to get a report about what's going on at Ohio State. I know, Dr. Johnson, Ohio State's been very engaged in testing students, and maybe if you can kind of give us an overview of, when school started back up and how many students are on campus, how many are living in the Columbus community, and kind of what you've been doing in regard to testing.
Thank you very much, Governor. So as you said, we started up our first full week of classes, started the week of August 24th. We have about 12,000 students living on campus. We have about 20,000 students that are coming back to get some kind of face-to-face or in-classroom instruction. So that's about 8,000 off campus that come to campus and about 12,000 that are on campus. So prior to me coming to The Ohio State University, certainly an outstanding team under the leadership of Dr. Gail Marsh set up a strategy for returning to campus. And once I came in, started working with the team, and we decided to enhance our testing. So we really are focusing on 3 groups right now. We're focusing on those, 11,500 to 12,000 students that live on campus. Mostly first-year students and some second-year students, few international students. And then 8,000 students that are off campus that come to campus. So that's sort of our group 2. And group 3 would be the 2,500 faculty, staff, and graduate teaching instructors that we have. So we're starting to test them fully. So to date, just by the numbers, I am an engineer, so I like to geek out on the numbers a little bit. We've tested about 40,000. We've done about 40,000 tests, I should say. So we're doing this on a weekly basis. We're ramping up to do about 20,000 tests a week. This is our 3rd week. So of the 40,000, we have about 1,500 students that have tested positive and 25 employees. So 1,500 out of about 40,000 is a positivity rate of around 3.7%. Now, this isn't just a flat rate, it's gone up. The on-campus positivity rate peaked in and around August, like 28, 29. We have a dashboard that's up at about 5.87%. So the fact that it has dropped, and it kind of, bounced around just like we've seen with the state of Ohio, but is a reason for cautious optimism that our non-pharmaceutical interventions really are working. So wearing masks, staying socially distant, washing hands, and our students, I couldn't be prouder of them. They've been very vigilant. Off campus, we had a pretty high number when we started testing them at scale last week. I think that it was at or over 11%. And now that's dropped in the recent dashboard. It is at about 5.45% for the last 24 hours. So we're seeing that, again, when I walk around campus and I walk around Columbus, I see our students more on campus. We need our off-campus students, faculty, and staff, and individuals in Columbus to be ever so vigilant wearing masks, but wearing the masks, staying socially distanced, it really works. So that's sort of the status with regard to testing, sir.
So, Doctor, as I recall, I think you may have told me that when students came back, you started, of course, the testing, and that's kind of snapshot the first couple of days back. The numbers were, I think, pretty low.
That's correct, right.
Somewhere around 0.5%, I think you told me, something like that. And then, is that right, or am I wrong?
No, I think you're close. I don't remember exactly, but I think it was certainly less than 2%. Maybe it was 1.5%. I think that was the number, but low, as you said.
Then it goes up,
right?
And now it's coming down. And I think that what is going on in Ohio State is instructive because you are doing a very, very significant amount of testing. So you really have a very good feel for what is going on. And I think, that might be helpful to, other places, particularly colleges, universities who might not have the capability to do the extensive testing that you were doing. So it sounds like they weren't bringing it in at a very high rate. Students get together, do what students do what we all do, and this gets up. But obviously your messaging sounds like it is having some impact now, and the kind of maybe peer pressure. But I wonder if you could maybe talk a little bit about that. Why do you think it's starting to come down or is coming down?
Right. Well, I think there's a couple things, and thank you, Governor. I think one of the things we recognized is we really had to amp up our contact tracing. So as soon as we get back a result that a student, faculty, or staff is positive, we start contact tracing immediately. So then we were able to isolate and quarantine those individuals that needed to be isolated, quarantined, or treated. So I think that was one thing. The second thing is that our student life organization, led by Dr. Melissa Shivers, has just been outstanding. And she's really engaged the whole community on Together as Buckeyes. So it's taking the pledge, recognizing that, yes, we can do alternative programming and still enjoy, but at a distance, the college experience. And I think that it was, as you said, students coming together for the first time and not recognizing that it's pretty easy to transmit this virus, but it's also pretty easy if you do just a couple things, wear a mask and stay socially distant, to stop it transmitting. And so I think that was another thing. I think a third thing is that we have a College of Public Health led by Dr. Amy Fairchild, and they started modeling certain behaviors and then modeling how those behaviors translate into positive cases, and then what our capacity would need to be in order to trace and then isolate and quarantine. And so I think coming together, the Wexner Medical Center has been superb. They do about 500 tests a day for us for symptomatic. So the way we've parsed it is we have the student health system services and the Wexner Medical Center be available for symptomatic individuals. And then we do the asymptomatic tracing through a third-party provider, because the last thing we want to do is take up any of the capacity from the state of Ohio for Ohioans that need access to the testing. So that's been our strategy. And I think that that Together as Buckeyes, we've engaged great athletic director Gene Smith. He's gotten the athletes, they've done these social media campaigns about what's your why? Why are you going to wear a mask, and why are you going to socially distance? For me, I came back to the academy because I love the students. I want to see the students out there on the oval. I want to see the faculty, the staff. I want to attend all the performances and the lectures and the richness that just drives a university. And that's my why. And each of us has a why. And if we just dig down and pull up that why, I think it's pretty straightforward why we want to do the things that will keep us safe.
Doctor, that you expressed that very, very well. We each have a reason. We each have a goal. And I assume for many students, it's simply to be on campus, to be part of Ohio State or be part of whatever college that they're going to. You mentioned a kind of a difference in numbers between off campus and on campus. And I'm going to make a statement. You don't have to agree with it, but I just assume that it's easier for a college to control what's going on directly on campus. Classrooms, for example, you can do the social distancing, you can do those things. When people are off campus, you have thousands of students who are in non-Ohio State housing. So I assume that maybe gets a little more difficult. You want to comment on that?
Well, yes, no, thank you, Governor. I think that, as you know, and you were great to be on the call earlier today with our inter-university President's Council of all the 14 public institutions in the country, and I think we're seeing all the same thing, is that on campus, the classroom is one of the safest places to be. We disinfect the classrooms a couple times a day. We reconfigure 450 classrooms so that we can be synchronous and asynchronous in our instruction. We reduce the size of our classes from 100 down to 50, because the models would say that in that situation, you can actually have a pretty high probability of avoiding someone who is infectious that would be in the classroom. So we find the classrooms are safe. Our dorms, we have great residential advisors, and they're being very creative about how do we engage students in programming when you have to stay 6 feet apart. If I can just say one thing about that, you know, I was talking to on my first day, I tried to go out and meet as many students as possible. And it's tough when you have to stay 6 feet apart. But I was on a Zoom call with some of the student leaders, and one student said, Alice, she goes, you know what, as first year students, we want to be part of that 2024 picture, you know, where all the students get out in the field and they do the famous Ohio, you know, from the band. And we missed that this year. And within 2 days, we set up to allow any student who wanted to come down the ramp onto the field, see their picture on the big screen, and get a photo of being on the field and the horseshoe, that opportunity. And we had hundreds, if not thousands, of students sign up in pairs, socially distant. And it's that kind of innovation I'm so proud of from our students. And it really is inspiring. So I think that's right. I think we have more of an ability to control things on campus. And off campus, I spoke with the Panhellenic leadership this weekend. Melissa Shivers and Jean Smith, our AD, spoke with the Interfraternity Council. And just to talk about in high density aggregate housing, whether it's fraternities or not, you know, this is really, you know, it's very serious stuff and it's very easy to spread. So getting out that message and communicating and, you know, we're all young ones, fortunately. And I think when I was that age, I thought I was invincible, and I learned pretty quickly I wasn't. So, you know, I think that that's something that we want to help our students move through and appreciate how important it is to wear a mask and stay apart, even when you're out.
Dr. Johnson, thank you very much. Good luck to you and the students and faculty and everybody at The Ohio State University. And I think you're off to a good start, and keep going.
Thank you, sir. Appreciate it.
Thank you.